Hogan at William Pattison. I'm here to do a advanced health assessment, and my patient is Olu. She gave me her permission to record her.
I give permission for the recording.
Okay, thank you.
You're welcome.
She's her appearance is well groomed. She's well built. She's alert and oriented. Time 4. Her skin is warm and dry to touch. And now I'm gonna do the assessment regarding her head. The head is symmetrical. I'm gonna palpate her hair to see if there's any bumps, any dislocation, any mass, and there's no depression. The head is flat and also is symmetrical. Next, I'm gonna go through the face. The face is rounded, symmetrical. There's no scar, there's no lesion, there's no bruises. We're gonna inspect the cranial nerve 5 and 7. For 5 and 7, I'll ask her to raise her eyebrows. Okay, bring down. The eyelashes also. Bring down. It shows that the cranial nerve 5 and 7 are intact. Now I'm gonna assess also the opening of the eyes against my hand resistance. Can you try to open your eyes? Yes, there's no pressure, there's nothing. The next, we're going to palpate the masseter and the temporal muscles. For the temporal muscles, I will ask her to clench her teeth. Good. Now I'm gonna assess the masseter muscles. I'm gonna ask her to open her mouth for me. There's no dislocation, there's no glint, and they're all symmetrical. The next, we're gonna do the eyes. For the eyes, I'm gonna do the peripheral vision and also the central vision. I'm gonna start from central vision. I'm gonna ask you to cover one of your left eye, please. Okay. Now for the left eye, it's closed, and then you're gonna read the last line for me, please.
L C F P H.
The reading on the reading on the left eye show that the vision is 20/20. Now, can you cover your right eye, please? Can you do now the reading for the last line, please?
L C F P H.
The vision on the right eye did show 20/20. That's for the vision for central. Now we're doing the vision for peripheral. For the peripheral, you're gonna close one eye for me. It's left. Okay. Close the left eye. I'm gonna close also the left eye. And then I'm gonna go with the 4 quadrant. The 4 quadrant, and you're gonna tell me how many fingers I'm gonna show you. 1, 2, 3, 4. How many fingers?
2.
How many fingers?
2.
How many fingers?
2.
How many fingers?
2.
Good. Can we switch now? Can you cover the right again? I'm gonna show you. How many fingers?
2.
How many fingers?
2.
How many fingers?
3.
How many fingers?
3.
Good. It showed that the peripheral vision is intact and there is no abnormality noted. The next one we're doing is the extraocular movement to check the cranial nerve 3, 4, and 6. Got my finger. You're gonna follow my finger. Go around. Go around. Keep following the eyes. This shows that the oculomotor movement is intact and the cranial nerve 3, 4, and 6 is there. The next we're gonna do is to inspect the eyelash and the eyelid and to see if there's any discharge. I'm just gonna see the eyelash, the eyelid. is intact. There is no scar, there is no swelling. The next we're gonna inspect the lacrima apparatus and the conjunctiva. The conjunctiva I'm gonna look is clear, there's no swelling, there's no drainage, and it's intact. Now for the apparatus, we're gonna look if there's any swelling also. It's intact. Now I'm gonna take my finger. Can you follow my finger? Go to the left. That's good. Go to the right. Now the sclera is normal, is pink, is clear, and there's no discharge. The next one we gotta do is the pupil dilation. For that one, we're gonna check the cranial nerve tray.
No!
I'm gonna look at the pupil to dilate. Both pupils are equal, rounded, reactive to light, and also accommodation is noted. Now the next step we're gonna do is a fundoscopic assessment. For that one, I need the light to be dim, and I'm gonna dim the light. I'm looking to the red reflex, the optic disc, and also the retina. You will see that the red reflex is there, the optic disc is intact, and also the retina is present and is on both eyes. Her nose, I can see that the nose is symmetrical and is on the midline. There's no deviation, and also the septum is in normal place, is intact, and there's no trauma. Are you feeling any pain? No. The next step I'm gonna do, I have to visual the nasal canal. I'm gonna look at this side. Lift your head up for me. Thank you. I can see that there's a hair, there's no drainage, it's pink, and there's no blockage. On the left side too, there's pink, there's a hair, there's no drainage, and also there's no blockage. Next, we're gonna check the sinuses. We're gonna check the maxillary sinuses. Don't mind to move your glasses for me, please.
Oh, sure.
Thank you. I'm gonna check the sinuses here, the maxillary for sinuses. It's intact, and also the frontal for sinuses. They're all correct. The next one we gotta check for the smell. For the smell, we gotta find the cranial nerve 1. I'm gonna ask her to smell what I give her, and she's gonna tell me what smell it is. Can you smell it? Oh, okay, that's correct. The cranial nerve 1 is intact. Now we're gonna move to the mouth. I'm gonna inspect the mouth. I see that the mouth is symmetrical. The lips is intact, is moist and pink. And there's no lesion on the lips. Now I want her to open. Can you open your mouth, please? From now, can you see that the mouth, the tongue is pink, and there's no swelling. It's moist. The hard palate is intact. I can also see the tonsil is red and is not swollen, and there's no exudation on it. Now I'm gonna check for the gag reflex. I'm gonna use the tongue bladder to check for your gag reflex. It's intact. Okay. Now the gag reflex I check is 7 and 9. Now I'm gonna go to the gum too, because I wanna see her gum. The gum is red. There's no drainage, and it's intact. I also wanna check for the swallow. Oh look, can you swallow for me, please, honey? Can you swallow? Yes, she got a good swallow. I can see the cranial nerve 12 is intact. Now the last one I'm gonna do here is for the taste, to check for cranial nerve 7 and 9. I'm gonna I'm gonna give her a gum, and she will tell me what's the taste is.
Minty.
Okay, number 7 and 9 is at that. The next step we're gonna do is to assess the ears. I'm gonna start from your left ear. Okay, I'm gonna move your hair a little bit on the side, and I can expose the pinna out. Her left ear is symmetrical. I'm gonna pull the pinna up and backward. There's no drainage. There's no swelling. Always hurt.
No.
Now I'm gonna check the tragus. I'm gonna press on it. It's hurt.
No.
Now I have to assess the ear canal. I'm gonna use my otoscope and look into the ear canal. In the ear canal, I can see there is a few hair on it. It's a gray color. The tympanic membrane is not bulging, is normal, and there's no redness. From there, I'm gonna move to the right one. I'm gonna expose the other ears. I'm gonna pull the pinna up. I see it's symmetrical. There's no redness. There's no swelling. The targus, I also put pressure on it. Always hurt.
No.
There's no pain. I'm gonna also check the ear canal. I'm gonna pull up and back. There's no swelling. There's no drainage. It's gray and with few hair on it, and the tympanic membrane is not bulging. Normal finding. Next, we're gonna move to the Weber test. The Weber test consists of hearing test. I'm gonna bump into it, and I'm gonna put you on the forehead, and you let me know when you can able to hear on both sides.
Yes, I can hear on both sides.
The next one we gotta do is the Weber test. It consists of making a noise here and put it on your left ear. Let me know if you start hearing it.
Stop. Stop.
I'm gonna do the other side too. On the left ear too, the same thing.
Stop. Stop.
The Weber test is done and the rhyme test is done, and show that he's really can able to hear on both ears and there's no abnormality. Now the next one, I'm gonna do the whisper test. I'm gonna whisper on her left ear, and I want Olu to close her left ear, and I will whisper and she will tell me what did I say.
Water.
I'm gonna do the same thing on the right ear. I will whisper and she will tell me.
Soda.
Good. We found that is normal finding for her ears. The next one we gotta do is we're gonna ask. The next step is to examine the neck and the throat, which is symmetrical. The trachea is on the midline. There is no deviation. There is no lesion. There is no swelling. Now the next step I'm gonna do is to examine the left node. Now the left node can be examined by palpating here. It's not palpable, and also on the left side is not palpable. Now I'm gonna look at also on the armpit. I'm gonna check for the left node. Non-palpable. The next step is to focus on the carotid. I'm gonna palpate the carotid. It's very strong. +2. There is no trail. The one on the right side It's very strong, plus 2,
Now you die.
and there's no bone.
Ow.
Now I have to listen also to the thyroid. I'm gonna palpate them. The thyroid is here. It's normal. It's on the midline, and there is no enlargement. Now I have to auscultate them.
I guess I'm
Plus
just
2.
gonna step
There's no trail. Plus 2 and no trail. The carotid also, the thyroid. Plus 2 and there's no trail. Now, Olu, can you swallow for me, honey? Now I'm gonna check the thyroid gland here to see if there's any abnormality noted. She can able to swallow one more time, and then is going up and down. Cranial nerve 11. I'm gonna move your head to that side for me, please. Go to the left. Good. To the right. Good. I'm gonna put my hand under your shoulder and to see if there's any resistance. Can you put it up? Down. Good. Cranial nerve 11 is intact. Now we're gonna do the chest.
Help me die.
The chest, I want her to be sitting on the sofa. That one I can able to examine. I'm gonna chest. I'm first gonna inspect the chest. It's symmetrical. There's no scar. There's no lesion on the chest. Okay. Olu, can you hug yourself? Like put your arm on there, and can you take a deep breath? This shows that there's a chest expansion. And also it's symmetrical. I'm gonna auscultate the lung sound. Take a deep breath for me, please. Another one.
Bro, I just respond.
Take a deep breath.
Go back.
One more. The lung sound are clear. There's no crackle. There's no wheezing. There's no adventitious sound I can hear. Now, Fremitis. Now, Olu, can you say 99 for me?
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99. 99.
Again.
99.
There's no resonance. There's no dull. The chest lungs are clear. Now I'm gonna percussion the chest. Any discomfort?
No.
Any pain?
No.
This is the examination for the anterior of the chest. Now I'm gonna do the posterior of the chest. Take a deep breath. Another one. Another one. Another one. Another one. The lung sound are clear. Now I'm gonna do the tactile fremitus. Can you say 99 for me, please?
99. 99. 99.
No.
99. 99.
No.
99.
There's no dull, there's no vibration, there's no resonance. All the lung sound are clear and are all in the normal limit, normal finding rate. The respiration rate usually is between 12 to 20. With my patient, her respiration rate is 18. And the respiration rate is easy, unlabeled, and no distress is noted. we're gonna do the heart. And I want her to lay on the sofa. Now I can examine her heart.
Okay.
The last system that we have to examine is the heart. That's why my patient is laying on the sofa. Now I'm gonna tell her to turn to the side to check for the JVD. There is no distension of the jugular vein. Next, I have to listen to the heart sound. First, I have to listen to the aortic sound, which is located on the second right upper intercostal. And then I'm gonna move to the pulmonic, which is located on the second. Now I'm listening to the heart sound. I'm start from the aortic, which is located on the right second intercostal. Now I'm doing the pulmonic, which is located on the second left upper intercostal. We go into the Earth point, which is located on the third upper intercostal. And the fourth sound is located on the fourth left upper lower intercostal, which is the tricuspid valve. And the mitral valve, which is located on the fifth intercostal on the lower side, where they have the PMI, and also where you can listen to the S1, S2 sound. The sound, there is no murmur. S1 and S2 I heard in the PMI. Next is gonna be the artery on the aortic, iliac, and also femoral. Okay, on the other side too. It's +2. There's no trail. Now we're gonna do the femoral. +2, very strong. There is no trail. On the left side, also +2, there is no trail. Now I have to listen to I have to palpate the radial pulse on the upper extremities. The right pulse is very strong, +2. The left radial is very strong, +2. There's no trail. Now I'm going down to the extremities to check for the popliteal pulse. On the left side is very strong, +2. On the right side also is very strong, +2. Now the tibial pulse is +2. There is no edema, there is no trail. On the other side too, +2, very strong, there is no trail. Now I'm gonna palpate the pedal pulse. It's very strong, +2. In the lower extremity there is no edema. And the left side also very strong, +2, and no edema. Thank you for watching.